everybody to this week's Interactive Virtual Experience, or IVX. This is the third in a series of weekly peer-to-peer discussions on practicing during the COVID-19 pandemic, and we are honored to have you with us today. We're here to share the best practices from one OD to another as we navigate the uncertainty around us. The last couple of conversations got off to a wonderful start, and so I can't wait to hear all of your thoughtful questions this week. My name is Dr. Carissa Lee, and I'm the head of professional affairs at Johnson & Johnson Vision. And just like you, we've had to pivot our business in the face of this crisis. Our goal is to always be here to support you and your patients, and you can take comfort in all that AccuView is doing to help. Our efforts have focused on helping you continue patient care, prioritizing safety at every level, and supporting your practice cash flow. So please feel free to reach out to your local sales rep if you'd like more information. Before we start, I want to go through a little bit of housekeeping. We want to answer as many of your questions as we can. So throughout the discussion, you can submit questions. Just click on the Q&A icon on the bottom bar and submit your thoughts. We'll answer as many questions as we can, and if we can't get to all of them, we'll certainly collect them and try to get them answered through future communications or back through your reps. So I was happy to see lots of chat traffic last week as well as this week already. So feel free to also use the chat module to share comments with the other attendees. Just make sure that you select all panelists and attendees to share your thoughts with everybody. I can't believe that I've been working from home for almost 2 months now. So I'm excited to hear the tips from today's speaker about how we can get back to a new normal as our communities slowly start opening back up. So let's get started. I'd like to now introduce you to Dr. Chandra Mickles. Dr. Mickles is a distinguished professor, clinician, and consultant. She's the director of Nova Southeastern University College of Optometry Dry Eye Center, where she's been recognized as Professor of the Year. Dr. Mickles is leading the way in identifying best practices for optometry clinics as we reopen with the new normal procedures. Please welcome Dr. Chandra Mickles.
Hello, everyone. Thank you, Dr. Lee. I am thrilled to present on this timely topic and to speak on the behalf of a company who has truly gone far and beyond to support us and our patients. I am really excited. I can't believe that over 700 of you are here, and I think we can really learn from each other. So what I'd like everyone to do is to take a moment, just take a moment and imagine that it is May 18th, June 1st, or whatever day you plan to reopen. And I want you to think, what do you envision your new normal to look like? In other words, what would you like your patients to experience in your practices? Well, in order for us to continue to deliver exceptional patient care, we have to have a well thought out plan. So I'm curious, how many of you have a well-structured practice reactivation plan? So what we're gonna do is we're gonna bring up this poll to see where you stand. All right, so we wanna see, do you have a structured plan, or maybe somewhat of a plan, or you haven't had a chance to start working on it yet? Now, I want you guys to be honest. The polls are anonymous, and it's not like I'm gonna be like, well, Jason doesn't have a plan yet, can't believe it. And even if you guys don't have a plan, it is okay. The important thing is for you to get it right. So I'll give you a couple of moments. Okay, so let's see the results. All right, so I'm not surprised that there are few of us that have a well-structured plan. And you could take down the poll. The reason why I'm not surprised, because this is uncharted territory, right? But I want you to remember when you first opened your practice, or the first time you started a new position, you overcame the unknown, right? I remember being fresh right out of my contact lens residency and being appointed chief of a contact lens service. And I'm just gonna be honest, I'm gonna keep it real. I was nervous. But the reason why I ended up doing well and tripled contact lens sales 2 years in a row is because I thought smart about it. I reached out to contact lens chiefs and successful private practitioners and leveraged the contact lens industry, who gave me amazing ideas and strategies. Well, the reason why I believe and hope that you will benefit from this presentation, because I did something similar today. I gathered information from not only the CDC, the CMS, the AOA, but I reached out to private practitioners. I reached out to clinicians in the VA and reached out to academic institutions across the country who have experts with a lot of experience in developing plans and protocols and have time to dedicate to doing this. For example, if at NOVA and other institutions, we have a COVID-19 task force that is made up of directors of clinical operations, deans of the various health professional programs, and even a compliance department that consists of attorneys that can give input, and also a environment and safety department can give some input. And they are working on this daily to work on a structured plan for us. So today, what I want you to think of me, I want you to think of me as your personal practice reactivation detective. And whatever mode of practice you are in, whether it be in private practice or in academia, or if you're in a corporate setting, we are all ECPs and we will get through this together. So what I'm going to do today as we go on to the next slide, ultimately, my goal is for us to know what items and processes are needed before our patients enter our clinics or practices. We'll also discuss what patient flow might look like. And then finally, I'll go into how we can prepare our patients for our new normal. Now, let's talk about gearing up. Let's first start with that. Well, I know that you guys know this, but I want to remind you of what we pledged to do. And that's, we pledged to put our patients first. So let's take a look at this next slide. So make sure we get to that slide. And in order to put our patients first, we have to think of their safety. And the one thing that we need to do is get PPE and certain tools. Now, I know you guys all know the PPE that is needed. You know that we need the masks and the shields. But what about some other tools like the non-contact thermometers? You may want to get disposable tonometry tips. And a lot of us are considering transitioning to scrubs. But the question is, it's not, you know, what we need. I think we've all have heard daily on the news and experienced it ourselves that there's this limited supply of PPE. So there's a limited supply of PPE, but how can we maximize the supplies that we have? And then if you think about it, purchasing all these supplies can add up. So how can we be safe and save? So one thing, if you look at the CDC guidelines, they tell us that as eye care professionals or health professionals, we need to wear surgical masks. But it's completely okay for our patients to wear the washable cloth. So we don't need to buy a whole lot of surgical masks for our patients. We do need some in reserve just in case when they arrive and they don't show up with the surgical mask. But that is one way that you can optimize your PPE. You also want to carefully prioritize when you use some of the other PPE, such as gloves, right? You want to reserve those gloves for when you are in close contact with your patients doing an examination, versus using those gloves on the keyboard and then you contaminate those gloves and then have to put on another glove when you examine your patients. You can actually use a keyboard cover if you are concerned about that and wipe it down. Now, where do you get this PPE, right? I said it's a short supply. So what we did is we compiled some resources and names and links, and the J&J team is going to send that through the chat. And at the end, I'm also going to provide you with some resources that you can take a photo of the slide. Okay, so let's get into talking about the scrubs. So when we think about the scrubs, ideally in a perfect world, right? In a perfect world, we would come to work and all of the scrubs that are for our staff and all employees would be purchased, and we would arrive and wear those scrubs. And then at the end of the day, they would be, we'd take them off and then they would be laundered, right? Now that is expensive, and we probably don't have the capability in our clinics and offices to do that. So one thing that you can do, especially in a multi-doctor setting that I am in, we have decided at NOVA that as staff and the doctors, we will be purchasing our own scrubs. And the university will supply us with badges with the logo and our name and designation. And of course, we will have all wear the same color, but that is another way you can save. Now, you also got to think about how you're going to refigure your waiting area. An important thing here, of course, is you want to keep your patients 6 feet apart. So you want to have the chairs 6 feet apart. And I think most of you guys know that. But you want to remove some of the other items that are in the office, such as magazines and toys. But people say, well, you know, I can disinfect those toys, but in all honesty, how are you going to keep track of that? So I say, just remove everything. And if you're in a practice where you see a lot of children, or if you're a director of a pediatrics clinic, then you need to tell the parents to bring something with them to keep their child entertained. Now, the next thing I want to discuss is patient scheduling, which is something you want to spend a lot of time on to get it right. You know, according to CDC, you want to reopen in phases. And the AOA says that practitioners will be opening at 50% capacity. At NOVA, we are following those guidelines, and we will be reopening in phases. And the plan is to reopen, at least for our 4th years, on May the 18th. And we will be at 25% capacity, just to ensure that we can minimize the number of people at one time. You also can stagger those appointments as well. Now, in the private practice setting, I'm hearing a lot that doctors will be scheduling their patients every half an hour to an hour to ensure time for proper sanitation of those examination rooms. Now, you not only need to think about how you are going to time your appointments, you need to prioritize when you're going to schedule those patients. So the first thing you're going to do, and I think most of you will be doing this, is you're going to reschedule those patients whose appointments were postponed or canceled during this time. And then you will prioritize those patients based on the complexity of their conditions. So you should see those patients that have diabetic retinopathy or glaucoma patients. And then for me, who I fit a lot of contact lenses, I will be seeing my specialty fits first, especially those incomplete fits. But you may also want to think about this as far as generating revenue. You may want to do a search and start looking into who are those loyal patients that always buy annual supplies of contact lenses, and maybe prioritize them or always purchase from your optical. That would be a good recommendation. The other thing you want to think about is reserving service hour, having reserved service hours for your patients, just like the grocery store, right? So you say 7 to 8 or 8 to 9. I will examine those patients that are high risk for developing the coronavirus. And or you can have virtual visits for those patients who really just don't feel comfortable in the clinical environment. Now, in a multi-doctor practice or multi-doctor setting that I am in, it's real easy to do that, right? Because we can have a rotating schedule on when we do the virtual visits. So, you know, one day a week I can do the virtual visits and another doctor can do another day. And those of you in multi-doctor setting, you can do the same. If you are in a solo practice, you just have to dedicate time and say, on these days per week, I'm going to dedicate time to doing virtual visits. And it depends on your patient population, how often you will need to do that. Now let's get into staff scheduling. When you think of the staff scheduling, you also want to minimize the number of staff in the office as well. And you can do a rotating schedule for them. At Nova, we already have a rotating schedule for our staff, and some of them are at home teleworking. But one thing that you can do, and what our staff will be doing, is that they'll be getting training on OSHA. So OSHA has some guidelines related to COVID, and the faculty will be trained on that as well. And at the end, I have a link for that. They also, the staff need to be trained on PPE use to ensure when they apply their PPE and remove it, they don't cause self-contamination. So the CDC has a training resource for that, and I have a link for that at the end. The other thing you want to think about as far as staff training is that you definitely want to do a practice run, right? You want to do a practice run to ensure that they feel comfortable and confident in how they are going to manage patient care, or help you manage patient care during this time. You can have a really well-developed plan, but doing this practice run can uncover some things you never thought of. So, Dr. Lee, do we have any questions on this section here?
We do. So we have a lot of questions. So I'm so excited about the engagement. I'm
like
hoping
900.
Yeah, with over 900 people, you can imagine there's a lot of questions here. One of the questions, I think some of them you answered, and I do see that some of the websites are already sold out. So again, I think this is something where you will have to just keep visiting them to see if they're stocked.
Yeah, so let me comment on that. I forgot to comment on that. Yes, you're going to have to keep going back. And our director of clinical operations, every week, she is checking the sites and checking how much PPE we need. So I definitely recommend that you assign one person to do that, because you're going to have to keep going back. Mm-hmm.
Yeah, so great tip. Are you, or do you already have some sort of COVID-19 waiver for patients to sign before being seen at your clinic?
To my knowledge, we don't, and I'm pretty confident we don't, because in an academic institution, and probably somewhere in the VA and other big institutions, we have attorneys that have to look through everything and approve it. They're trying to work fast as they can right now, but we probably don't have it yet, but I'm sure they are working on something like that.
Okay, great. And then in terms of, I guess, just cleaning equipment, and specifically the Goldman tonometer, what do you do you rotate your tips? Do you soak them in hydrogen peroxide? What guidelines are you guys following there?
So based on the studies, the best way to disinfect the probe is to use diluted bleach. Some of the other options, you still have some infectious agents like the proteins there. So I would recommend using a diluted bleach for 5 minutes. The really best option is what we are doing. We are actually ordering disposable tips.
Great tip there. And then one of the questions is about wearing a slit lamp, or doing a slit lamp exam wearing a shield. And do you feel that the slit lamp shield is sufficient? What do you do when you do a slit lamp exam with your patients?
So I would use the shield. I mean, you really need to protect your face. You really do. I know that there is also a recommendation about using goggles. So for now, it appears that it's one or the other, because if you think about using goggles and the shield, it's going to probably fog up, and then we can't do what we really need to do, and that is examine our patient's eyes.
Yeah, good tips. And just to reiterate too, a lot of the resources that I've seen, so AOA has a great website, a guidelines website that they think they just put up on Monday. Links to a lot of the CDC websites and OSHA that you have been recommending or referencing as well.
Yeah, and at the end, we definitely have those resources of all the different preparedness guidelines, so you could just go right to it. If I did not mention, as far as some other places for PPE, they have the AOA Cell GPO is also a place you can get PPE. You can check out Amazon Business. They are supplying PPE for healthcare professionals.
Yeah, and one of the questions is how or what do they clean even if they don't have an optical? So what are you guys doing in between patients or in your clinic?
Do you mean like in the examination room or?
Yeah, so the question is just about how and what do you clean even if they don't have an optical? So I'm guessing it's surfaces.
Yeah, so like the doors, all the surfaces, the chairs, the slit lamp, pretty much everything that, you would touch. Yeah.
Yeah, and are you cleaning those in front of the patients generally or are just in the downtime, or do you have specific techs doing that too?
So I'm going to get to that on the patient flow section.
Oh, okay. I'm sorry. I'm stealing your thunder.
No, that's okay.
So lots of other questions.
Explain it.
Yeah. I don't know. I mean, this one is specific about the bathrooms, and it might be different in your situation because you're in an academic setting. But the question is, are they open to the public or closed? Do you allow access, and how are they maintained?
So we are fortunate and, in a large institution to have housekeeping. So that is their role, to constantly clean the bathrooms, or keep them clean. As far as also a big institution, we have a lot of entrances. So we have blocked off all the entrances except one, and we have staff at the front monitoring who can come in.
And then what type of mask are you wearing then?
Yeah,
are you just wearing a surgical mask?
Yeah, so we are wearing surgical masks. Everyone that comes into, other than patients, are wearing surgical masks.
Good. So what was the dilution ratio of bleach to disinfectant that you were saying for the tonometry tip?
So it's 1 to 10.
Okay, 1 to 10. Do you guys have a non-contact thermometer, I'm guessing? And did you have that before? So they're asking where you get it. And then do you use a direct ophthalmoscope for children?
Okay, so we did not have a non-contact thermometer until this pandemic. So we had to purchase it. Most of the supplies that the university, where they're getting it from, is Henry Schein, which is a health product solutions. And then I know the director of clinical operations, she just shared me, she's trying everything that she can to find supplies, because a lot of things are on back order. So that's why I wanted to make a point of trying to find ways to optimize the PPE you have or conserve the PPE that you have.
Yeah, that's going to be, I think, one of the biggest challenges as we move to reopening our clinics too.
And then the DO, I'm all honest, my specialty is contact lens and dry eye, so I rarely see children. But I would assume the folks in the pediatric department, that's what they're doing or will do.
Yeah, and I think that's going to be up to every clinician, right? What their level of risk is, and maybe there's some, questionnaires that you ask the parents before you see the children to mitigate the risk that you're imposing upon yourself,
yes, for
based
sure.
on the exposure that child may receive. So some of those are tough calls. Okay, so one last question before we move on to the next session. I think it's just clarification. If you were talking about using a slit lamp, like those breath shields at the slit lamp, or using a face shield when you're doing your exams.
So we have the slit lamp shields on all of our slit lamps. So that's the primary protection. I feel like it doesn't hurt to also wear a face shield. Just looking at the CDC guidelines that and the AOA, you know, you want to protect yourself as much as you can. I think it's a little overkill doing the goggles. I think is in or, but I have seen in some resources that I looked at, and those are for, you know, doctors, let's say like ophthalmologists or other doctors that they may be exposed to blood and things like that. In our case, I doubt that's going to happen.
Okay, perfect. Well, thank you. And again, we've got lots of questions, but in the interest of time, I'm going to move you on to the next section so we can hear more of your tips.
All right, so let's move on to resetting patient flow. And I think a great way to think about this, or when you're planning this, is to think of one of your favorite patients and how you imagine that she or he will go through your clinic or practice from check-in to check-out. And one patient that I think of is a 64-year-old female who has dry eye. And I think we all have these patients. She always arrives early and she talks a mile a minute, but she's really kind and refers patients to me all the time. And you know, brightens my day with her positive attitude. So to protect her privacy, I'm going to call her Mary. And so what's going to happen when Mary comes into the clinic? So when she comes in, she's going to get her temperature taken, and she's going to be asked questions that may or try to exclude that she or rule out that she has the coronavirus. So the thing that is recommended by the CDC is you need to do both. You need to take the temperature and also ask those questions. And I know that is not perfect, but what this does, it puts the patient's mind at ease that we're trying to do something to screen patients and employees and everyone as far as not having anyone in the clinic or your practice that has coronavirus. So for us at NOVA, everyone, all of us that enter the clinic, we will be getting our temperature taken and be asked those screening questions. Now, what happens when Mary goes to the front desk? Well, ideally, I would love it if it was contactless, right? She would go up to the front, speak to our receptionist, and he would check her in. A lot of this stuff, you know, she's an established patient, but if she was new, she can do a lot of the intake forms, answer those questions at home before she arrives, right? But if you can't do that, then I recommend that you have your patients bring a pen, their own pen, or use disposable pens, or have used and unused bins for those pens. So now, Mary has gotten through the check-in. Are we going to do pre-testing on her? Are we going to do any ancillary testing? So I'm very curious to find out your thoughts on that. So we're going to pull up this poll. All right, so will you be performing pre-testing or ancillary testing? Or will you be performing both? Or you don't plan to do any at all? And you know what, J&J team, I can't see how many are responding, so just let me know when you think we should show the results.
Yeah, I think we should give them just a few seconds because I think once they click it, it'll just go right into the poll.
Okay. All right, so let's show the results. Okay, so the majority said that they would do both. So now we can bring down those results. I was definitely curious about this. And the reason why was the other day, I had a Zoom chat with some contact lens and dry eye experts, and we were all from different modes of practice. And when someone asked, so what are you guys doing about pre-testing and ancillary testing? You know, everyone's like, I don't know. And what the consensus was is that we were saying that we would only do pre-testing or ancillary testing when it was really necessary. And one of the reasons why is that, remember, you need to bring the patient to another room and it's possible contamination at that room, and then you still got to sanitize another room, which makes your flow inefficient. The other thing, let's think about, if you think about some of the ancillary testing like visual field and the topography, how are you going to really disinfect the bowl of the visual field? And we don't really know how long the virus remains in that enclosed space. So what I'm going to do is I will, once again, reserve pre-testing and ancillary testing for when it's really needed, and kind of look at the instruments that I have and kind of see, well, this instrument I can clean well, so maybe I will do that pre-testing for that patient. But for topography, I'm going to reserve it for those keratoconus patients, those new ones where I have no information or have any way to figure out where I'm going to start with a lens. So kind of think about that. I do know that Heidelberg, if you have their OCT, the Spectralis, they have made some shields or breast shields for that. So now with Mary, my dry eye patient, she doesn't need pre-testing. All right, so I'm just gonna bring her to the examination room, and what's gonna happen there. So when I bring her to the examination room, I'm gonna tell her that for the most part, this room has already been pre-sanitized, but I'm going to disinfect some things in front of her, like some of the surfaces and the slit lamps. And why? Because I'm sure that's going to make her feel more comfortable that she sees me sanitize some of those instruments. Now think about it. When you go to a restaurant and you're waiting to be seated, doesn't it make you feel more comfortable that you see the busboy clean out the table? I know for me, and especially now when we start to reopen these restaurants, I want to see that. And then as far as when am I going to put on my gloves? So when I put on my gloves is after, of course, I thoroughly wash my hands, but it's when I'm really ready to examine Mary's eyes. And before I examine Mary's eyes, what am I going to do? I'm going to tell her that while I love all her stories about her vacations, and I want to hear about her children and grandchildren, doing the slit lamp examination, I am going to minimize talking to her, and she should do the same. And then we can catch up on everything, once we're done with the exam. Okay. So now I'm done with the exam, and Mary says to me, you know what, Dr. Mickles, I heard about these scleral lenses that can help with dry eye. So now I got to teach her how to apply those lenses. And what am I going to do? Am I going to bring her to the I&R area? Well, no, I'm not. I'm going to keep her in that same examination room so I don't contaminate the other areas. And in a multi-doctor setting that I am in, we often end up having several people in that I&R area. If you're in a solo practice, you may not have to worry about this, but for those of us in a multi-doctor setting, you definitely want to consider just doing I&R in that room. Other thing that happened on that conference call, Dr. Sue Resnick, who I love, she's a contact lens expert, she said that she's going to purchase those disposable hair nets or caps that they use in the hospital so that her technicians feel comfortable if they need to touch their patient's head when they are teaching them application and removal. But now, remember what these specialty lenses, like scleral lenses or hybrid lenses or soft specialty lenses, we reuse these lenses over and over again on various patients, right? So how can we prevent the spread of pathogens under these situations? Well, the contact lens sections of the AOA and the American Academy of Optometry came up with new guidelines for proper disinfection or in-office disinfection of these lenses. And I want to make it clear that this was not due to the pandemic. It was actually published at the end of 2019 and actually launched at the January 2020 Global Specialty Lens Symposium. So you can easily get these guidelines on the Gas Permalens Institute website. They also have free laminated cards that you can place in the areas where your technicians disinfect those lenses. So, you know, and at the end, I also have links for that if you want to use that. Now, Mary is wearing contact lenses, and she, you know, let's say she's currently wearing soft contact lenses. And I do want to say this. I am a part of the Contact Lens Assessment and Use Group, which is a research group, multi-center research group that's been over a decade looking at risks associated with contact lens wear. And there is a low risk of contact lens complications or corneal inflammatory events with contact lens wear. However, you still want to hone in on some particular aspects of patient education, and we think that targeted patient education is a great thing to do now. So when we look at, and I look at the literature of other great teams and folks that study a lot on research, do a lot of research in this area, there are key things that you want to educate your patients on, either because it is a really risky behavior or because your patients aren't complying with it. So number one, you need to educate your patients that they need to wash their hands thoroughly before they put on and before they remove the contact lens, because about 50% of patients or contact lens wearers are not doing that. Then the next thing you need to do is ensure, you know, other than Ortho-K, that they do not sleep in their lenses, because that is a great risk for soft contact lens related inflammatory events. And, you know, we all know that daily disposables are the safest option, but I think a lot of you may not know, especially those really successful practice who primarily fit daily disposables. In the United States, most patients are in reusable lenses. About 75% are in reusable lenses. So you really want to educate your patients on care of their cases or cleaning of their cases and replacement of their cases at appropriate intervals. It's 1 to 3 months. I say I educate my patients every 1 month so that it's easy to remember. And then the last thing is, now, there has been a decrease in contact lens wear during this time, and Dr. Philip Morgan, who is an excellent researcher, did a study looking at what is the reason. And of course, the study was in the UK, but it probably is similar to what we would see here. The reason is really not that patients think that contact lenses are unsafe during this time, is that they're just at home and don't find a need to wear their contact lenses. And I think that will probably continue for a little bit until people start going back to work. So it is critical for you to educate your part-time wearers, especially if they're not daily disposable wearers, on proper disinfection of their lenses when they are not wearing them, like keeping track of it. Like after 28 days, if you're using multi-purpose solution, they still need to clean and disinfect those lenses. Now, Mary, she was able to get the lens in, and I'm going to order some lenses for her. So she is on her way to check out. Now, as she checks out, I'm gonna have a staff clean in the room and disinfect it while I go ahead and use another room and see a patient. So if you're in a multi-doctor setting and you have several examination rooms, you can easily coordinate that. If you're in a solo practice, then you need to set time to for that sanitation of those rooms or disinfection. Now, when Mary goes through the checkout, one thing I think is very important, that we have the tape there that separates our patients by 6 feet, because that is where it really gets crowded. I don't care how well you schedule your patients. At some point when they check out, there'll be a couple of them there at one time. The other thing that I would love is if that checkout could be contactless as well. So during this time, just like you know, I went to the pharmacy, went to the grocery store, and I was trying my best to be healthy, because I know that I'm sedentary at this time, but I broke down and went to a fast food restaurant. And when I look at all the different places that I've been to, the fast food restaurant did the best job in the whole credit card processing process. So when I went through the drive-through, The cashier pulled out the credit card machine, and all I had to do was slide the card in. So I never had to touch that machine, and she never touched my card. So if there was a way that we could do that in our practices, I think patients would really appreciate that. Another option is that you can purchase finger cots, and those are around $6 for 200 finger cots, and that should make your patients feel more comfortable. So Mary has checked out and had a hopefully good exam. So Dr. Lee, what questions do we have?
So we only have time for a couple questions, but I'm going to pick the ones that got asked multiple times. So the first one is, any suggestions how to safely train contact lens insertion and removal?
So like I said, the best that we can do, as I said, try to keep the patient in the same room. Definitely use gloves. You can also use that cap that Dr. Resnick recommended. You can prep them with videos, and JJ has great INR videos, so maybe you have to spend so much time in the examination room going over application and removal.
Yeah, I will point out one of the things that we do have is something called Lens Assist, where the patients can call. So if you look up AccuView Lens Assist, you can find it. It's patient facing, and they can call or video chat, whatever is most comfortable with them, and can help them through that remotely. Another one is the question that keeps coming up is, do you have any suggestions for dealing with fogging lenses? So those, especially if they're wearing masks behind the proctor.
Yeah, so you may want to, I know there's anti-fog spray, and then there is also, if you try to recommend that they have a mask so it's better contoured to their face so the heat or the warm air doesn't go up and cause the fogging. I'm trying to think what else. I know I've seen putting a tissue here to kind of absorb some of the moisture as well. And then you might have to pop out and do loose lenses. Yeah. Mm-hmm.
Yeah. One last question, this has come up, is about NCT and versus applanation tonometry. So it sounds like you guys are doing Goldman rather than NCT, but any thoughts on that?
Yeah, I mean, I'm definitely concerned. I think others are concerned as well, with like the puff of air and kind of spreading the germs doing that. So like I said, at Nova, we are purchasing disposable tonometry tips. Mm-hmm.
Perfect. So let's, again, lots of questions. So we'll have to see if we have time at the end, but I'm going to move you on to your next section.
All right, so let's talk about how we can prepare our patients for their new normal. So I'm curious, how are you guys communicating with your patients? So let's pull up that poll. All right, so how are you guys communicating with your patients? Let's see, there's several different options there. Mm-hmm. Oh, I just saw somebody write that they use tonal pens. That is also another option because it's, it's a similar disposable way to do that. You put a cap every time. Eye care might be another option. And there's several options of taking pressures. Mm-hmm. Okay, I'm gonna keep answering questions. I shouldn't look at the chat.
Yeah, so why don't we go,
let's pull down
the polls.
Yeah, so let's see the results. Okay, as expected, most of you guys are doing phone calls and text. Actually, I do love that because it really builds that patient-doctor or doctor-patient relationship. But whatever method that you use or platform, communication is great. But I think there's a big difference between communicating and connecting with your patients. And I think you need to connect with them, that you care, that they will be safe, and that you are prepared. And let me share with you this story to illuminate this. So my mom lives in New Jersey, which, it's been a hot spot. And yes, I live in Florida, but I will always be a Jersey girl. And she doesn't mind me sharing with, sharing this with you is that she has several underlying diseases. So she has diabetes, she has hypertension, and she is a cancer survivor. Now, she may not want me to share her age, like most of us don't want to do, but she is in that age group that has great risks for developing coronavirus. So during this time, though, she had to go to 2 doctor's appointments, and that made me very nervous, and she was very concerned as well. But after one of her doctor's appointments, she called me and she kept raving on and on about this doctor. I think it was after half an hour. I was like, okay, Ma, I got it. He's amazing. But the reason why she kept raving about him is because he really showed her that he cared before the exam, demonstrated that she would be safe, and that he was confident that he could see patients because he was protecting the patients and his employees. And so what did he do? He connected that and shared with her what she should expect before she arrived. So she would sit in the car and wait to be called when they were ready for her. He told her what to bring, the mask and her own pen. But really what set this doctor apart from some other doctors is that he went over his sanitation protocols and measures that he was taking. So I definitely think that you should emphasize this, because patients do want to know that you are keeping them safe as long as your employees or staff. And then he also shared with her some alternatives that will be available if she really didn't feel comfortable coming in. So that gave her some peace of mind. You can do this with whatever platform that you use, but then it's also important to remind patients by calling them on the phone and discussing this with them. So do we have any questions about this, Dr. Lee?
Yeah, so one of the questions is about how often you're changing your PPE. So do you have a new surgical mask for each patient?
Oh yeah, so you need to replace that surgical mask for really every patient. That's why it's getting concerning a little bit how much PPE we are going to need.
Another one is, are you going to see less patients in your day? I think you talked about this, but are you separating them in your schedule?
Oh yeah, so like as I said at Nova, and I've heard this in some other schools, is that we are going to be that first, in the beginning, that first phase will be at 25% capacity, and then we'll just based on patient demand, the state of COVID, and what our state guidelines are. So there's definitely not going to be the same number of patients or faculty clinicians in the clinic as we normally would have during that first phase. And I kind of think of it as a soft reopening. We kind of get everything going. The other thing that we are doing that you may want to consider is that we are only opening our main clinic at first, and then we're going to start opening our satellite clinics. So we start running things smoothly and then move on to the other sites. So you may want to consider that if you have multiple practices or you are in academia, and you might want to recommend that to your dean.
Yeah, so are you guys restricting the age of patients? So I think you mentioned maybe the option of seeing those at risk, like the elderly patients at a different hours, but is your clinic seeing pediatric patients as well too?
Yeah, I mean, we are seeing pediatric patients. I probably should, and this is a good point for the future. I probably should have spoke a little more to my pediatric chief and see, what her thoughts are as far as like how much we're limiting, like how young are they going as far as the patients that they are seeing. But our pediatric clinic is open right now for urgent care, and then they will be reopening as we plan on May 18th. We gotta get our students some practice too. If they're going to become doctors, I mean.
Yeah, that is a challenge. I think, I'll jump in here too. I think that also just depends on their chief complaint as well, right? So certainly if they have a problem that we need to or could take care of, and keeping them out of the ER, for example. I think certainly those are some questions that you may want to consider. Again, lots of great tips from you and lots of really great questions, but let's move on to the next section too.
All right, so you have gotten through the first phase, or you designed and worked on your plan for the first phase. What should you be doing next? Well, I definitely think you need to designate time to prepare for the next phase. So maybe, sometime during the week, think about what your next phase will be and how that will look. And then you want to develop contingency plans. So God forbid we go back to the stay-at-home order. So what could you do better than what you are doing now? What changes would you make? The other thing you may want to consider is, what if patients aren't coming in the way that you expected them to? So even now, I recommend reaching out to those doctors who refer patients to you. Another thing that you should consider, may want to consider is, when your staff gets a call saying that your patient has canceled their appointment, they should write down the reason why, so that you can address those issues in some of your materials that you send out and the way you communicate with them. So the next slide, we're going to talk about we're running out of time, some resources. So let's go to the next slide on resources. So here you can take a photo or a screenshot of some of these resources that I mentioned during this presentation. And then please feel free to email me if you have additional questions. You can always find my email on the NOVA website. I truly hope that what I shared with you today was beneficial, so that on May 18th, or whatever day you plan to reopen, that you can hit the ground running. And believe me, sooner than you think, we will come out of this darkness into a brighter day where we can get back to doing what we love. So let's get started on our new beginning. Thank you.
Yeah, thank you, Dr. Mickles, and thanks everybody for all of your thoughtful questions. I know we had a lot that we did not get to, but this is an opportunity again to start talking at a local level, and we'll have some smaller, more regional sessions that we can where we can hopefully get to a lot of the questions. So we will continue to listen to all of your feedback so that we can provide you with helpful events like this. Our next interactive virtual experience like this one will be taking place next Wednesday, May 6th. So if you go to the chat, you'll see a link to register. Dr. Damon Durker will be our next speaker, and he'll dive into specifics on incorporating telehealth into your practice during this COVID-19 and beyond. So we hope you'll shape and continue to shape the future of this IVX series with us. So please take a moment to answer one last poll question where you can share what topic would be most valuable for our next event. Your voice is important to us, and we want to stay connected with you. So we will continue to broadcast these national events, but please reach out to your local rep, because we're also holding smaller regional roundtable discussions, as I mentioned, where you can speak directly to each other on what matters most to you. So I would like to thank Dr. Mickles for all of her wonderful insights, her tips, everything that she shared. She is a real inspiration to us all. So have a great rest of your day, and please be well.
Bye, everyone.